Every day in pharmacies, people who have just turned 40 walk in to buy a box of Asboside 75. The common reasoning is that a daily low-dose baby aspirin will act like a preventative daily vitamin to protect the heart and keep blood flowing. Treating this medication like a harmless dietary supplement is a dangerous misconception. You are ingesting a highly active, potent chemical agent. The active ingredient dissolving into your system is acetyl salicylic acid. This is the chemical name for aspirin, and at the molecular level, it is engineered to forcefully alter how your blood behaves. Its primary medical function is to act as an antiplatelet medication. An antiplatelet is a specific class of drug designed to physically prevent blood cells from binding together. It provides zero nutritional or vitamin-like benefits. When you introduce a powerful anti-clotting drug into a completely healthy cardiovascular system that doesn't actually need it, you risk turning a perfectly stable body into one that is fragile and highly susceptible to bleeding. To determine if this drug is necessary, we have to look at how blood normally operates. Inside a healthy human artery, red blood cells and platelets glide past one another. They flow completely unimpeded without sticking to vessel walls. This illustration shows the dangerous alternative. In patients with narrowed or diseased arteries, platelets can aggressively clump together. They form a solid blockage or clot, which directly leads to heart attacks. When a patient takes Asboside, the acetyl salicylic acid molecules bind directly to the platelets. This physical connection disarms the platelets, making it impossible for them to lock onto one another. For high-risk cardiovascular patients, a 75 mg dose is perfectly calibrated. It is the exact amount needed to stop those specific, life-threatening blockages from forming. However, if a person with entirely normal, healthy blood flow takes this same dose, they are forcing an antiplatelet agent into a system that has no blockages to clear. By artificially preventing platelets from performing their natural clotting function, you strip the body of its ability to seal up and heal even the most minor, everyday internal injuries. The first signs of excessive blood thinning usually appear right on the surface. You might notice unexplainable dark blue bruising blooming under the skin from the slightest bump or physical impact. You will also see microhemorrhages. A very common indicator is persistent daily bleeding from the gum line during normal, routine toothbrushing. But the surface-level bruising is mild compared to the unseen internal dangers. Acetyl salicylic acid is inherently acidic, and that chemical nature attacks the digestive tract. Looking at this anatomical cross-section, you can see exactly where the corrosive risk lies. Unprotected aspirin burns directly into the stomach lining, causing intense localized inflammation and, eventually, a bleeding ulcer. Any theoretical benefit you thought you were gaining by taking an unprescribed pill is completely erased if the drug is actively inducing chronic external and internal bleeding. If your doctor has determined you actually need this medication, you must follow strict operational steps to protect your stomach. The first mandatory rule is to never consume Asboside on an empty stomach. This flowchart illustrates the precise sequence you need to follow. Step 1 is eating a solid, healthy meal. Step 2 is taking the pill exactly in the middle of that meal, or immediately after you finish your last bite. Following the pill with a large glass of water is a critical part of this process. The water dilutes the drug and creates a buffer against the acid, heavily reducing the risk to your gastric tissue. That protects your daily routine. But you also need a strict protocol for any external medical procedures, specifically invasive dental work or major surgeries. You absolutely must formally declare your Asboside usage to your dentist or surgeon well before any operation begins. Because your blood is chemically thinned, your doctor has to establish a specific timeline to pause your medication days before the procedure. Without this pause, you face the severe risk of uncontrollable surgical hemorrhage. Taking Asboside safely requires active management. You have to monitor your daily meal timing, stay hydrated, and proactively communicate with every healthcare provider you see. Even with perfect protocols, you have a daily responsibility to self-monitor your body for the extreme red flags of gastrointestinal failure. The primary pain indicator to watch for is sudden, severe pain localized distinctly in your upper stomach area. The primary visual indicator will appear in the bathroom. If your stool turns exceptionally dark, resembling a deep black color, you have a major issue. When these two symptoms appear together, it means one specific thing. You have active, dangerous internal bleeding occurring deep within your gastrointestinal tract. If you encounter these signs, the safety protocol has failed. You must seek immediate emergency medical intervention. To synthesize everything we've covered, we have 2 absolute rules. Rule 1. Never self-prescribe Aspersid simply because you reach a certain age or because you want to vaguely protect against heart disease. Rule 2 is even more dangerous. If a cardiologist has prescribed this medication to you, never abruptly stop taking it on your own. When you suddenly remove a suppressive drug from your system, your body exhibits a fatal physiological response. It triggers the rapid formation of a rebound clot, a hyperreactive state where platelets aggressively swarm and clump together faster than before. If you have an inserted heart stent, this rebound effect causes an instant, life-threatening blockage to form directly on top of that vulnerable hardware. This comparative flowchart summarizes the reality of Asbosed 75. It is a highly effective, life-saving tool for approved heart patients, but a massive liability for unprescribed users. Real cardiovascular protection doesn't come from borrowing neighborhood habits or treating potent drugs like daily vitamins. It comes from a precise, medically supervised protocol tailored to your actual biology.